All right, so today we're going to be talking about Addison's disease. All right, so today we're going to be talking about Addison's disease. So, what is Addison's disease? Addison's disease is a rare chronic condition in which your adrenal glands are insufficiently producing aldosterone and cortisol. Addison's disease was discovered in 1855 by a doctor named Thomas Addison, and he described the condition as primary adrenal insufficiency. What is the prevalence and the statistics of Addison's disease? For the population, the prevalence in developed country is that it affects about 100 to 140 million people. For gender prevalence, Addison's disease is more likely to affect women than men. For age prevalence, Addison's disease is more likely to occur in people between the age of 30 through 50. For the mortality rate of Addison's disease, with proper treatment, it's about a 5 to 10% mortality rate, but without proper treatment, the percentage increases significantly. It could even be about 100% of mortality. So, what is the clinical significance of Addison's disease? This disease can reduce the quality of life. It can require long-term treatment. If you get an early diagnosis, there is an improved expectancy of life expectancy, and being educated and aware can catch the disease early, or it can reduce the number of misdiagnoses. What are the symptoms of Addison's disease? Some symptoms include fatigue and weakness, skin changes, weight loss, and salt cravings. These are some of the most common symptoms for individuals who have Addison's disease. For fatigue and muscle weakness, cortisol is essential for energy metabolism, and with Addison's disease, individuals are unable to produce enough energy, leading to the constant feeling of being tired and being weak. People with Addison's disease often develops dark skin patches in multiple areas, and they can also be seen as more tan than usual. This is because the pituitary gland is releasing more ACTH, leading to an increased production of melanin. For weight loss and salt cravings, individuals with Addison's disease find themselves with a lack of hunger and unintentionally losing weight. Due to the body having poor nutrient absorption, the body does not regularly maintain an appetite. Also, due to poor nutrient absorption, the body increases cravings and the desire for sodium. Overlapping symptoms and conditions of Addison's disease consist of anemia, diabetes, and hypothyroidism. So the feeling of fatigue and weakness can even come from a simple cold, but these symptoms are quite universal and oftentimes can be overlooked because of how common these symptoms are. Vitiligo and hyperpigmentation is also an overlapping symptom slash condition because it is hard to isolate just that these dark patches or being tanner are just isolated to Addison's disease. For unexplained weight losses, there are multiple other conditions, but some include GI disorders, hyperthyroidism, and even cancer. The pathology of Addison's disease consists of the adrenal glands are failing to produce enough cortisol and aldosterone, and the common cause is commonly identified as autoimmune destruction of the adrenal cortex. Some other causes for Addison's disease include TB, HIV, genetic defects, and more. Physiological changes, at the cellular level consist of cortisol deficiency, aldosterone deficiency, and ACTH overproduction. For cortisol deficiency, decreased glucogenesis, impaired stress response, and altered immune regulation are some of the things that are going on at that cortisol deficiency. For aldosterone deficiency, there's reduced sodium reabsorption and potassium excretion, leading to an electrolyte imbalance. For ACTH overproduction, due to a lack of negative feedback, that increases the amount of melanin, and that's what leads to the dark patches. At the clinical level, low cortisol can lead to fatigue, weight loss, and low blood sugar. Low aldosterone can lead to low blood pressure, salt craving, and dehydration. High ACTH and the melanin stimulating hormone can lead to hyperpigmentation. And when there is a severe deficiency of these changes, adrenal crisis with hypotension, shock, and even death can occur. So for the diagnostics, there's also, for the criteria, there needs to be an evidence of adrenal hormone deficiency. So this is tested through low morning serum cortisol and elevated plasma ACTH. Low morning serum cortisol can strongly suggest Addison's disease. Another test that you can do is ACTH stimulation test, and this is a positive test would indicate when cortisol fails to rise adequately after a injection of synthetic ACTH. For electrolyte imbalance, low sodium and high potassium would indicate something going on that could possibly be Addison's disease. Autoantibody testing would be having positive adrenal cortex antibodies in the autoimmune system for Addison's disease. Blood tests include cortisol, ACTH, sodium, potassium, glucose, renin, and aldosterone levels. So we just want to test that in the blood to see how they're being affected. Cortisol and aldosterone would definitely be significantly lower than the normal. You could also do autoantibody testing and screening. So the ACTH stimulation test is technically the gold standard for the diagnosis of Addison's disease. Imaging could be used, and a CT or MRI of the adrenal glands would show the most information. Autoimmune system, you can see small or atrophic adrenals or adrenal glands. Infectious or hemorrhagic, you can see enlarged or calcified glands. Additional tests consist of TB testing if infection is suspected and screening for associated autoimmune disorders. For the treatment and how effective treatment can be, types of treatment, there is no cure for Addison's disease. This makes the treatment lifelong. Some treatment consists of hormone replacement therapy, and it is commonly used to manage the disease. Becoming educated on the symptoms of Addison's disease and crisis situation is much more important than focusing on a cure. How effective is treatment? Obtaining treatment can reduce changes of fatality significantly. However, it does not promise that you will not have adrenal crisis. Treatment is long-term and can require frequent doctor visits and retesting of blood levels and so on. Medication options for Addison's disease consist of hydrocortisone, which is a cortisol replacement, prednisone, which is also a cortisol replacement, Medrol, which is also a cortisol replacement, and fludrocortisone, which serves as a replacement for aldosterone. Lifestyle changes for Addison's disease can include increasing salt intake, especially with exercise and sweating. Individuals with Addison's disease may need to practice mental health care to avoid the trigger of an adrenal crisis. It is also important for the affected individuals to carry a corticosteroid injection kit for emergencies. Recommendations for unknown situations consist of carrying a medical card that provides information about your condition, keeping an extra medication with you at all times, carrying a corticosteroid injection kit with you at all times, maintaining communication with your primary doctor, and maintaining regular visits to ensure your health is being evaluated regularly. Ongoing symptoms of Addison's disease consist of fatigue and muscle weakness, hypertension, and risk of adrenal crisis. Consequences of the treatment of Addison's disease consist of psychological effects. So individuals with Addison's disease may develop and may develop an experience of anxiety, depression, and other mental health issues. There's also an increased risk of developing other autoimmune diseases. So as many as 50 individuals with Addison's disease develop a separate autoimmune disease. You could also have a possible decrease in the quality of life. So due to the symptoms, treatments, and other factors, individuals may find themselves constantly dealing with the effects of their condition, and this can reduce their ability to complete activities of daily living. The prevalence trend of Addison's disease is that the disease is considered rare. Prevalence is slowly increasing, and there has been an increased survival rate after diagnosis. Due to more knowledge and development, more cases have been identified sooner. The take-home message is that Addison's disease is a rare but serious endocrine disorder that can be well managed with lifelong hormone replacement. Early recognition could save someone's life. And with proper care, individuals can live an active, full life. These are my sources. Thank you.